In a quiet hospital room, Sai, a college student, faced an unexpected challenge. He contracted HIV during his stay. The news is spread on campus and it reaches his three close friends, Alex, Kirtana, Radha, and Professor Tarun, who decided to visit and offer support. During their visit, Radha hesitated to touch Sai. She quickly distanced herself from him and moved out of the room. And the story continued as
Why did you react like that, Radha?
Don't you know that HIV can be transmitted through air or even simple physical contact like handshaking or touching? That's the reason I have reacted like that.
Come on, Radha. That sounds like some fake news or misinformation.
Alright everyone, let's clear up everything about HIV with some accurate facts.
Professor, before we dive in facts and about HIV, can you please give an overview of what's family of its genera, how exactly it affects the person?
Sure thing Alex, let's discuss about how HIV progresses in the body.
Wait, isn't it true that HIV only infects people with a darker skin?
No, Radha, that's not true at all. HIV doesn't affect people based on their color, gender, or religion.
Thanks for the clarification Kirtana. Let's talk about the symptoms of HIV. It often has symptoms like fever and fatigue which are flu-like symptoms.
And how can someone find out if they are infected by HIV?
Good question. We can diagnose HIV through blood tests which detect the antibodies or directly the virus itself. But early diagnosis is very important.
Then what about prevention, Professor? How can we avoid getting infected by HIV?
Well, using of safe sexual methods like using of condoms, avoiding the sharing of needles can reduce the risk of transmission.
Professor, what about antiretroviral therapy? How does that work?
Excellent question Alex. Antiretroviral therapy can really increase the person's life, but medication with consistency is the key.
Professor, are there any recent advancements regarding HIV in therapeutic or diagnostic fields?
Well, the diagnosis for HIV is basically divided into 4 types. The first one is vaccines, which are still under development. The second one is genetically modified immune cells, which are practically resistant to HIV. Third type is immune therapy. And the fourth type, which is a diagnostic method called Western blotting.
our skit undercovers the need for HIV awareness, emphasizing the importance, compassion, and breaking down the stigmas. This majorly depends on the conversations and the supportive environment. The major motive of this skit is to spread the awareness regarding HIV and build an inclusive society.
Compassion over stigma, unity over AIDS.